is damp heat. Okay.
Damp heat.
Tonight na ba? This afternoon, we have 4 cases. Critical.
Okay na.
Our first patient is a female, 28 years old. Tongue description, pale red, swollen, slightly wet, with teeth marks. Yellow, thick coating with red points at the root and slight notch at the tip. Symptoms are itching and burning in the vagina, swelling and redness in the labia, smelly, soft stools, foul-smelling flatulence, tiredness, and strong inner tension. Western diagnosis is acute candidiasis. Background to disease, condition followed frequent use of antibiotics and long-standing emotional problems. Chinese diagnoses are spleen qi deficiency with accumulation of dampness, retention of damp heats in the large intestine and genitals, and slight heart blood deficiency. Now let's try to analyze. Spleen qi deficiency with accumulation of dampness in this case is reflected in a pale red tongue body color, swollen tongue body shape with teeth marks, and has slightly wet tongue coating. Patient in this presents symptoms of tiredness. Okay? Retention of damp heats in the large intestine and genitals manifest a yellow, thick coating with red points at the root. Patient in this case presented symptoms of itching and burning in the vagina, swelling and redness of the labia, smelly soft stools, and foul-smelling flatulence resulted from frequent use of antibiotics. Slight heart blood deficiency in this case is presented in a slight notch at the tip of the tongue with symptom of strong inner tension resulted from a background of long-standing emotional problems. Okay? Now let's go to our second patient, male, 33 years old. Tongue description, pale red, wide with curled up edges, small horizontal cracks in the center of the tongue, dry, greasy, thickened, and yellow toward the posterior third. Symptoms are pain upon defecation, frequent dribbling of urine, burning sensation with urination, dizziness, inner tension, insomnia, and itchy skin at night. Western diagnoses are chronic prostatitis and chronic urticaria. Background to disease, alcohol and drug abuse, excessive sexual activity, and long-standing emotional problems. Chinese diagnosis, slight retention of damp heats in the liver and gallbladder with liver qi constraint. Onset of stomach yin deficiency and accumulation of damp heats in the lower burner. Now let's go to analysis. Slight retention of damp heats in the liver and gallbladder with liver qi constraint in this case is shown in a pale red tongue body color with wide curled up edges. Patient presented symptoms of frequent dribbling of urine, burning sensation with urination, dizziness, inner tension, and insomnia resulted from alcohol and drug abuse, as well as long-standing emotional problems. Okay? Onset of stomach yin deficiency in this case is reflected in a small horizontal cracks in the center of the tongue with symptom of itchy skin at night and pain upon defecation. Then accumulation of damp heats in the lower burner in this case is manifested in dry, greasy, thickened, and yellow tongue coating toward the posterior third, resulted from excessive sexual activity. Okay, now let's go to our third patient, a 24-year-old female. Tongue description: red, swollen, red on the right side of the tongue without coating, and dark yellow, greasy coating. Symptoms are paroxysmal one-sided facial pain, especially in the temple and cheek, irritability, facial redness, and insomnia. Western diagnosis is trigeminal neuralgia. Background to disease: alcohol abuse, heroin addiction in the past. Then Chinese diagnosis are accumulation of damp heat in the liver and gallbladder, excessive heat in the gallbladder, and long-standing retention of damp heat. Now let's go to analysis. Accumulation of damp heat in the liver and gallbladder is manifested in a red tongue body color, especially on the sides, with swollen tongue body shape. Patient presented symptoms of irritability and insomnia resulted from alcohol abuse and heroin addiction in the past. Excessive heat in the gallbladder is reflected in a red tongue body color, especially on the right side, without coating, with symptom of paroxysmal one-sided facial pain, especially in the temple and cheek. Okay? Long-standing retention of damp heat is shown in a dark yellow greasy tongue coating with symptom of facial redness. Okay, so now let's go to our fourth patient. A female, 41 years old. Tongue description: reddish, long with curled down tip, reddish center at the tongue, yellow, thick, greasy coating with red, swollen papillae at the root. Symptoms are purulent and black.
Yung audio niyo po, Ma'am Teresita. Naku, nawala na.
Hello po, hindi ako maririnig.
Hindi po.
Wala. What happened?
Okay na po, Ma'am Teresita.
Okay na.
Okay na po,
Salamat.
Ma'am Teresita. Okay na po.
Salamat
I can
po.
hear you.
Okay, so saan ba tayo? Okay, repeat ko na lang. Tongue description: reddish, long with curled down tip, reddish center of the tongue, yellow, thick, greasy coating with red swollen papillae at the root. Symptoms are purulent and bloody stools with cramp-like abdominal pains, burning sensation at the anus, thirst, slight fever, weight loss, and tiredness. Western diagnosis is ulcerative colitis. Background to disease: family history of ulcerative colitis, long-standing emotional problems, severe demands at work, caffeine and nicotine abuse. Chinese diagnoses are heat in the heart blood, heat in the stomach, retention of damp heats in the large intestine, transforming into heat toxin. Okay? Now let's go to analysis. Heat in the heart blood is manifested in a reddish tongue body color with long and curled down teeth, resulted from long-standing emotional problems. Heat in the stomach is reflected in a reddish tongue body color, especially at the center, with symptoms of thirst, weight loss, and tiredness, resulted from severe demands at work, caffeine and nicotine abuse, and has a family history of ulcerative colitis. The last is retention of damp heat in the large intestine, transforming into heat toxins, is presented with a yellow, thick, greasy coating with red, swollen papillae at the root, with symptom of slight fever, purulent and bloody stools with cramp-like abdominal pains, and burning sensation at the anus. Okay, yun lang po.